From oxygen to lactate, let's see how the body works. Shock is nothing like fear, but shock means that your organs are dying. It is the most common cause of death in case of surgical patients. This is very important even in our day-to-day life. How do you define shock? These definitions are known to be said as the same in the tough textbook. These words are very important. It is a systemic state, not a local state. So it is a systemic state of low perfusion, that is decrease in O2 delivery. Low perfusion, that is inadequate for normal cellular function. So that is not sufficient for normal cellular physiology. Systemic state of, there will be systemic state of decreased O2 perfusion, that is inadequate, not sufficient for normal cellular function. So there are two types of respirations in our body, mainly aerobic respiration and anaerobic respiration. In aerobic respiration, the end products are CO2 and water, that is carbon dioxide and water, whereas in anaerobic respiration there will be a lactic acid production. So when there is decreased oxygen delivery to the tissue, what will happen? There is decreased oxygen, so the cells can't perform aerobic respiration, so they will switch to anaerobic respiration, where the end product is lactate, which is increased in case of decreased tissue perfusion. So in case of reduced O2 delivery to the tissues, cells will switch from aerobic to anaerobic metabolism. The pathophysiology of shock is mainly of three types: cellular, microvascular, as well as systemic. Okay. In case of cellular mechanisms, same as we have discussed, at the level of cells, aerobic to anaerobic switch, which will cause increase in lactate production. So this lactic acid, when it is increased, it will cause metabolic acidosis, systemic metabolic acidosis. And in the cell membrane, there is something called sodium potassium pump, which you all know. The sodium potassium pump usually sends the sodium outside of the cell and takes the potassium into the cell. So whenever there is shock or decreased oxygen delivery, this pump will stop functioning. What will happen? So the sodium which is supposed to go out and potassium which is supposed to come in, this pump will cause dysfunction, so this potassium will go outside. That is, it will cause lysosome activation. What is lysosome? These are the suicidal bags of cells. That is, whenever cell wants to die, it will take this pill. I'm just kidding. So this is a lysosome. It has enzymes which will cause the disruption of the cell membrane, thereby causing the cell death. When a cell is dead, potassium will come out of the cell, increase in the potassium. So there will be hyperkalemia. So failure of the sodium and potassium pump in cell membrane will cause lysosome activation. See what I have told, it will cause self-engulfment of the cell, that is autodigestion, and causes increase in potassium in the blood. Okay, next comes the microvascular mechanism, where what is microvascular mechanism? So in case of tissue ischemia, there will be two systems activated in our body. Here comes our heroes, which are nothing but immune warriors, which they always fight against the pathogen inside our body. So they are known as immune warriors. So these are the immune system activation as well as the coagulation system. These two will get activated when there is tissue ischemia due to decrease in oxygen delivery to the cells. So what will happen? So this one I have tried to make it into a diagrammatic way so that you will remember it more well. So this is a vicious cycle which I wanted to emphasize. Whenever there is a hypoxia at the cellular level, and I have mentioned this already, it will cause acidosis due to increase in the lactate, and cell death will cause increase in the potassium. So these two will activate the complement and leukocytes. These are the leukocytes, that is B cells, CD8 cytotoxic T cells, or natural killer cells, and our policemen, regulatory T cells. Here comes our ninja, CD4 helper T cells. So all these lymphocytes and complement system will get activated. What does they do? At the cellular level, they cause O2 free radicals. Due to the reaction, they'll release free radicals at the cellular level. These free radicals, they doesn't stay quiet. So they are like small kids which they'll try to disrupt everything. So free radicals will go and injure our capillary endothelial cells. These capillary endothelial cells, due to disruption of the vessel wall, this will cause, what is this? What am I depicting? This is a leaky capillaries. So this is very, very important term. Leaky capillaries, which will cause the, due to this leak, all this fluid will be accumulated into the tissue, causing tissue edema. This tissue edema will cause, that fluid will be there in the tissue, so this will cause hypoxia at the cellular level, thereby again decrease in O2. Again this cycle continues. This is the vicious cycle of microvascular level. So this is very important. So next comes our systemic mechanism, that is systemic pathway. What are the systems you know? So what are the vital organs? Heart, lungs, kidney, and to function everything, your endocrine system. These are included in your systemic pathway. In case of cardiovascular mechanism, what is this? This is doing something. What is this? This is preload and this is afterload. Before. So what is preload? The volume of blood in the ventricles that is left at the end of diastole, that is end diastolic volume is your preload, and afterload, that the body, that heart that has resist to overcome the circulate blood. So resistance left ventricle must exert to overcome the circulating blood. It's called afterload. So in case of shock, there will be decrease in preload as well as afterload. What does the body do? So body will immediately get alert. So something wrong is happening with the body. So we have to change it to normal. We have to normalize this. Always there is something called homeostasis, where the body always try to cope up to maintain the body in a state of homeostasis. There is decrease in preload and afterload. Immediately it will send signals to the brain. This is called baroreceptor reflex. This is one of the survival mechanism that is present in our body. So what does it do? The baroreceptors will detect the change in the arteries. So arterial pressure will be detected and they will be sent to the brain. So they will tell brain that there is decrease in pressure in the arteries. So we shall try to improve it. So brain will agree to it. Yeah, we have to improve it. So the brain will send the signals to the heart via vagus nerve, as well as the cause stimulation of the sympathetic nervous system. All these will together cause catecholamine release and increase in the heart rate as well as systemic vasoconstriction. So what is this sympathetic activity? We'll see in the later slide. So this is the increase in sympathetic activity, ultimately leading to increase in heart rate to cope up with the decrease in preload as well as afterload. So next comes our respiratory system. So let's consider a small example. So you are so and so person. So you are going slowly over the road. You are happily enjoying the view and you are going. Suddenly you see a snake coming out. What do? You will get panicked. So this will cause increase in the sympathetic activity. What do you do if the snake is coming behind you? You will run. So you will try to run, right? What will happen if you run? Your heart rate will increase. So you will have increased respiratory rate. You will start fast breathing. So all these are called sympathetic activity. This is the stress response. So whenever there is sympathetic response, what will happen? There will be increased heart rate. So blood will move away from the digestive organs. What is this? This is tremor, and there will be fast breathing and pupil dilatation leading to tunnel vision, and you will sweat like anything. So this is the sympathetic response. So in case of respiratory system, as we have discussed earlier, there will be metabolic acidosis as well as increased sympathetic activity. This is very important. This will cause increase in the respiratory rate and minute ventilation. So respiratory rate will increase, so there will be increase in CO2 excretion. CO2 washout will happen. So this is the compensatory respiratory alkalosis to your metabolic acidosis. Did you understand the reasoning behind the compensatory respiratory alkalosis with metabolic acidosis? Okay, next comes our favorite organ, that is kidney, the renal system. Whenever there is decreased preload and decreased afterload, they will be decreased in the perfusion to the kidneys, thereby decrease in filtration of glomerulus. This will lead to oliguria. So again the homeostasis will apply here. There is the another survival mechanism, very important to us to cope up with stress, that is renin angiotensin aldosterone system, RAS. So whenever there is change in blood pressure or decrease in sodium, the body will release from the kidney, renin will be released. This will be converted to angiotensin and aldosterone. This angiotensin 2 will cause increased thirst. So in case of any patients with obstruction or any perforation, they are in the shock, so they will be having the renin angiotensin aldosterone system. So they will ask you for water, there will be increased thirst and sodium and water resorption by the aldosterone, as well as vasoconstriction will be there. So these are the mechanisms by which the body will cope up to the decreased urine output, that is oliguria. It is vasoconstriction and sodium and water retention at the level of kidneys. Next comes our endocrine system. Due to decrease in preload, there will be activation of our favorite RAS and activation of adrenal cortex. Where does adrenal line? Above the kidney. The center area is known as medulla and the periphery is called cortex. From the cortex, cortisol is released, leading to sodium and water resorption, as well as the sensitizes the cells to the catecholamines. And vasopressin or antidiuretic hormone, this will be released, leading to vasoconstriction and water resorption in the collecting ducts in the nephron. This is the brief description of definition and pathophysiology of shock. I hope this video is helpful to you. This is mainly taken from the Bailey. I try to simplify it to you. If you find it helpful, please like, share and subscribe to my channel. Thank you. And in the next video, I would like to post the classification. How does the body try to cope up with all these? What is resuscitable shock? What is unresuscitable shock? What is compensated and decompensated shock? All these continuation of this topic, I will post it in the next video. I hope this is helpful to you and thank you. Please subscribe to my channel. Thank you.